Hello, my name is Gudrun Sageder. I'm from Austria, Vienna, and I want to ask you today about your supplement intake. Are you already taking supplements or not? Are you focusing on a guest-based supplementation or is it test-based? It's your personal decision, and I want to show you some aspects in this way. So, why should you take supplements if you don't really need them? There are some very important pillars concerning your health. It's first of all, it's your sleep. Second, it's your balance between the different essential fatty acids. I will go further into these details. And then it's a lack of different micronutrients. And a big topic is also the high blood sugar level and your gut health. Today, I'm going to talk about these three principal subjects, the main subjects, which are the disbalance of the fatty acids. It's the lack of vitamin D, very common. More than 1/3 of the whole population has a lack of vitamin D. And we're going to talk about the high blood sugar level. So why is it important to have this control about the disbalance of the essential fatty acids? You need essential fatty acids for several reasons. First of all, there is one essential fatty acid group called the omega-6 fatty acids. Their task is to start inflammation. It's arachidonic acid who is in charge of starting inflammation in our body if it is due to a virus, a viral or bacterial infection, or it's also an injury, for example. And this inflammation must be stopped by an anti-inflammatory process, which is normally launched by another fatty acid out of the omega-3 group. So it's either EPA or DHA who are in charge of that. But we also need fatty acids, especially once again the omega-3 group, to improve our hormone level. So if we have a disbalance, we have reduced hormones. And the third very important role is that omega-3 fatty acids, they regulate the cell membrane fluidity. So if we have a look at the cell membrane and we have a lack of omega-3 fatty acids, it's gonna be a problem because nutrients can't be absorbed and waste can't get out of the cell. We're gonna go a little bit deeper into detail a little bit later. Second point is the lack of vitamin D. A lack of vitamin D can cause depressions, tiredness, or fatigue, but also can start osteoporosis and, in general, a weaker immune system. And the third column is the high blood sugar. High blood sugar, long-term blood sugar, is always a sign for the risk of diabetes type 2. So we call it a pre-diabetes. It can also be already a sign for an insulin resistance, and it can also be a sign for overweight or obesity. This is something normally you already see from the outside. So, what is exactly this disbalance? We have our bodies made for a genetic balance of 1:1, one part omega-6 to one part omega-3. So this is the optimal version, but it's right now very rare to find that. 3:1 is scientifically spoken the limit. Yeah, let's say it exists sometimes. 15:1 is much too high, but it's the common balance, I would say, the common ratio. And 25:1 is really much too high. And you can believe me, this is not the limit. I have already seen 80:1. So this exists now more and more often, and this is really a big sign of lots of problems coming up. So how can you measure now? You measure that through a so-called Balancetest. This test is quick and easy. You can also do it at home. You make a prick in your fingertip and you take 2 drops of blood, put it on a little paper, and then send it to an independent laboratory. They are based in Oslo, in Norway, and they do the analysis. As you can see, they work with lots of international universities, very well-known universities, also the Max Planck Institute in Germany, for example. And they do this testing, and then you get your test result through a website, which is very detailed. If you want to have a look at all the details, it's explained. It's not like an analysis that you get from a laboratory when you do a blood test at your doctor's, where you have to have a medical certificate to do the interpretation. Here, everything's really explained in details, and it's really easy to understand. It's a little bit like the red light, yellow light, and green light. So green is fine, yellow is in the middle, and red is a warning signal. So let's dive deeper a little bit to the cell membranes. I told you about the cell membrane fluidity. It's very important to have a good cell membrane fluidity. As you can see on the left side, the cell membrane, if there isn't enough omega-3 and too much saturated fat and omega-6 fatty acids, we will have a hard and rigid membrane, which means nutrients, they have difficulties to penetrate, to come into the cell, and also the waste after the metabolism has difficulties to get out. So we start to, let's say, starve our cells, and on the other hand, also make our own intoxication of our cells from the inner side. But if we bring our balance back to 3:1 or lower or better, our cell membrane of the newly produced cells will have a normal, soft, and flexible cell membrane. So nutrients can penetrate and waste can get out of the cell, and our mitochondria can really be well nourished and function correctly. So this is a very important fact in this cell membrane fluidity complex. How to get back to balance? Well, the company I work with called Zinzino, based in Sweden, they produce a very intelligent product. It's a mixture out of polyphenols from olive oil. It's pre-harvested olive oil with lots of polyphenols as antioxidants. And they have either a product based on wild fish oil, omega-3 rich fish oil, or also a vegan version with marine microalgae. The big difference, because they are liquid products, is that we can do a dosage per kilo body weight. And it depends also the age. So children, for example, they have a different recommended intake dosage than adults. But there is also a capsule formula. So there is also recommendation per kilo body weight. The only difference is, instead of the whole quantity of olive oil, there is also polyphenols from cacao powder. In Europe, there is an administration called the European Food Safety Authority, EFSA, and they admitted 18 health claims to this product. And as you can see on the left side, it's a normal brain function, it's a normal brain heart function, and a normal immune function. These are already very large topics, I would say, but there are some other very important health claims that we can mention, like it's normalizing the blood pressure, normalizing the cell division, the triglycerides level, the cholesterol level, the teeth, the function, the vision function, and it's also very important, plays a very important role in the development of the brain and the eye function of the fetus, and also of the breastfed infant. So that's very important for all ages, and for most of the population, there is also the second big issue that we can test, and this is the question of, do I really have to supplement vitamin D? So a vitamin D is, as I told you, a problem also for about a third of the population. Why? As you can see on the right side here on the map, it depends on your location where you live, and also on the latitude, if you get enough vitamin D from the sun. But there are also some other risk factors or factors to take into consideration. It's like the season, of course, if it's winter, if it's summer, the age of the person, the skin type, the skin color. Dark skinned people need more vitamin D than light skinned people. Pregnant women, of course, they need more vitamin D. It also depends on the weight. It depends on your nutrition, if the nutrition contains vitamin D, but also the clothes you're wearing. Of course, if you wear shorts and t-shirts, for example, your skin can absorb vitamin D more easily than somebody who is completely covered with clothes. It's also an important factor if you use sunscreen. Sunscreen blocks the sun from touching your skin and from producing vitamin D. And also, of course, if you're doing outdoor activities or not, and if there is lots of pollution. So you really have to put that also into consideration. So how can we check now the vitamin D level, and what do we really need? We can use our nutrition also as a source of vitamin D, but as you can see on the left side, per 100 gram of salmon, we just get a little dosage of vitamin D3. You can get it also from sardines, from eggs, from cod, from mushrooms, cow milk, and also from breast milk. But to give you another shocking number, for example, you would have to eat 10 kilos of veal liver to get enough vitamin D per day. So that's really a little bit shocking, I would say. So what is another solution for that, and what is another point to take into consideration? If you do a vitamin D test, it should also be, once again, quick and easy and to be done at home. It's again the laboratory Vitas who does the analysis. Again, it's anonymous, the testing, and then you get your vitamin D level. It's again very easy to understand because you have graphics and that shows you exactly are you on which range you are. You can shift here between nanomole per liter or nanogram per milliliter. So very easily done. Of course, there's also a recommendation how you can solve this problem. And normally people would take vitamin D with vitamin K. Zinzino says this is not necessary because the most important role to get your vitamin D activated in your body is magnesium. So magnesium is also very important for your immune system. It's also very important for the bones, for the teeth, for the muscles. And then if you add it with the vitamin D, which is important for the cell division, for the absorption of calcium and phosphor, and for the level of calcium also, this gives a very perfect synergy of a product. So Sinoshine Plus is a mixture. It's a blend of a broad spectrum magnesium from all natural sources. So it's nothing synthetic. It's completely natural. And vitamin D3 out of leeches. So it's also a natural source. It's therefore also a vegan product. So that was the second test that I could show you. And then there is the big subject of sugar. I almost don't eat sugar. I'm taking care of not putting too much sugar in my coffee or in my tea. Is this really true? We can check it. It's a so-called HbA1c test, which tests the long-term blood sugar. So this test is done, again, pricks in the finger, blood drops on a piece of paper and sent to the laboratory in Oslo. But we also add 24 lifestyle questions. And these lifestyle questions will give you then a real lifestyle analysis. You will get an overall health score in percentage, as you can see here on the right side, and you will have your long-term blood sugar. And of course, and that's the very important thing, you will a whole analysis with recommendations. So you have recommendations concerning the gut support, the metabolic support, immune, brain, bone, and joint support. And as you can see here on the right side, you have the different symbols. Again, it's like the street light. So it's red, yellow, and green. And everywhere where you have a red sign, you should improve something. And then with the to prevent the risk of getting diabetes type 2, there are recommendations with a whole lifestyle guide that you can apply. So you will have the recommendation to do more a daily activity, more sports activity, doing more cardio and strength, or to do more physical activity, less sitting and more physical activity again, or even behavior recommendations concerning your food. So more fibers, for example, more fruit and vegetables, less salt, soft drinks and candies, or for example, more fish. And even there are recommendations and plans that you can fill out. So it's a very, very nice overview to get into a better shape and having a better result. So my recommendation, stop with guess-based supplementation and go to test-based supplementation. Thank you for your attention, and please contact the person who has sent you this video to get more information about this test-based concept from Zinzino. Thank you so much.